Hello, everybody. This is Dr. Jean-Guy again today for, I guess, the tip of the week or a question that's been asked frequently, or some of you have had experience with some of it, and maybe you did not even know that that's what you were going through. So I just thought I would explain to you the three types of chiropractic care that people go through typically into a chiropractic office. So in our office, when a patient comes in, the first thing that they're going to go through is what we call the initial intensive care. And the purpose of that is to allow, usually it's based on symptoms, a person feeling better. And what's happening in that period of time, usually it will take about 2 to 4 weeks to get through that period of time, is when a person has inflammation, they have pain, they have restriction in motion. And this is, as it relates to their spine. So if they have neck pain, if they have back pain, if they have headaches, whatever that might be. So at that moment in time, what's going to happen is by increasing the mobility into the spine, right? If there's better motion, it will help with the inflammation, also help with decreasing pain. And that's usually the first period that, people will go through. And again, as I said, that's usually the first 2 to 4 weeks. And then even more exciting, the second part of the chiropractic care is the part that we call rehab care or corrective care. Specifically in our office, we call that corrective care because our goal is to restore the normal spinal curvature. Just like your blood pressure, there's an average, there's normal. Well, for the spine, there's also an average and normal for the spine as well. So we want to restore the proper curvature in your spine. So for instance, in your neck, you should have like a banana shape. That's what it should look like from the side. From the front, it should be straight, right? So it should not be either to the left or to the right. Your skull should be sitting right on top of your rib cage on top of your hips on top of your feet. So this is the goal that we want to be achieving on the outside, and also the goal on the inside where your spine from the side should have curvature. It looks like a banana, right, in your neck. And then it should also, when we look at a person on the outside, your head should be on top of your shoulders, and your shoulders should be on top of your hip on top of your feet. That should all be straight. So we're working on people's posture and we're working on people's spine. So we looked at both in order to, apply corrective care. When we do corrective care, to me, this is the most exciting part because now we are correcting the underlying cause of the problem, right? Especially for long-term effect and long-term benefit. And I tell people, I was just telling a person this morning, I said, do you go to the dentist just when you have a cavity? Well, of course, the answer to that is no. We're not waiting until we have pain. We go to the dentist to make sure that, if things are working well, we want it to continue that way. So when we go through the corrective process, what we're doing at that moment in time is now we're going to work on what's holding the spine together as well as the chiropractic adjustment. So the most important part of all of this is the chiropractic adjustment, where you are realigning the spine, and you can do that in different ways, either by hands, or it can be using a table that will be dropping, or we can use an instrument, right? And then we going to be working on what's holding the spine, which is ligaments, muscles, tendon. And we want to work on that. And how we do that is by doing some specific spinal corrective exercises and traction that is specifically for the spine for that particular individual. So once we get to this portion right here of the corrective care, this can be, it can be from 3 months to 6 months, depending on the problems that you have and how much damage there is in the spine. So just think of it this way. If a person were to have braces, for most people, they have to wear braces for a few years. Fortunately, the spine, when we get to corrective care, if a person chooses to do that, then it can be, 3 to 6 months. That's usually the time frame that it will take for the spine to start changing, on top of doing things at home as well, right? And then the last part, which is the wellness care, this is for people who say, hey, you know what got me well will keep me well, is to say, if my brain and nervous system controls everything in my body, I would like to just make sure that this is functioning properly, that my body is functioning properly for the rest of my life. So by the time a person gets to wellness care is now I'm not in pain, I've corrected the underlying cause of the problem, meaning that my spine is in proper alignment and I have good posture, and I continuously will work on that because we're going to give you some homework and exercise to do at home as well between the visit. And then we have this thing called wellness care, and wellness care is we want to just be the best that we can be. So by the time you get to this point here, it has nothing to do with a person's pain, is they just want to be the best that that a person can be, and usually people will do that with their family as well. So I just want to take a little bit of time to explain all those three processes to you guys, because for most people, they've been to the chiropractor. I don't know if it was ever explained to them, and we try to do this here with every patient at our office, and I think that this is important. that even if you knew that this is a good reminder to say, what are we accomplishing in all those different areas, which is, just to recap quickly, the first part is basically to handle pain and discomfort. The second part is to correct, to bring you back to where your spine should be from a structural point of view. And then wellness care is to benefit from you being the best that you can be, to improve, to have maximum function where your body can be 100% at all time. I hope you guys got something out of this. I hope you guys are having a great day in this Monday. Have a good week. Bye-bye.